Hi guys, welcome back to the channel. If you're new here, my name is Nosa. I'm a medical doctor in the UK and I make videos on medicine and lifestyle. So yeah, if you're new, welcome. And to those of you that are my old subscribers, thank you guys so much for being patient with me. I've been MIA for the past month and it's only because, like I mentioned in my previous video, I just started GP training in London. So basically, I'm a GP registrar now. And honestly, I'm loving it. My current program is first year ST1 is in GP. I've got HIV/GOM next, and then after that I think I have ED, and then after that I have GP again. So technically I only have one more year in the hospital during my GP training before I become a fully qualified GP. So yeah, I mean, I'm settling into work. I'm so happy I'm back in London, and I'm going to be taking you guys today on what a day is like in my life as a GP registrar. So let's start with an office tour, shall we? So yeah, obviously this is the door. Just give you a brief look. So obviously you've got two chairs that don't match for my patients, blood pressure monitor there. I'm not going to show the screen because obviously there's confidential information, but yeah, obviously this is the computer I work with. Phone, printer to print off my prescriptions and any letters I want to give patients. Obviously I've got my bag there. I've got my fan / heater because obviously it gets cold or hot. Then I've got the window, and then scale to measure patients' weight. Obviously this is self-explanatory where you wash your hands and stuff. tells you how to wash your hands as well, in case you do know. Here in this cupboard, I've got my air freshener because sometimes you need that. I have a speculum here, swabs, urine bottles, stool bottles, and all of that down here as well. Clinical waste bin, sharps bin, which I hardly take bloods here anyway, but this is the bed for examinations with the light. Obviously before my examinations I would put my tissue on the bed like that. But yeah, so that is my office. Quick overview, decent sized, happy with it. So yeah, that's my office. I mean, it's small, but it's just nice to have your own space, which you would never get in a hospital. I'm going to show you guys what my rota is like. For those of you interested in knowing what a GP registrar's working hours are like, bearing in mind that this can vary by practice and region. So I'm in North London, so this is what we're doing at my practice. Anyway, this is an example of what a rota would look like at my practice. So you start at 9 on a Monday, finish at 5. But when it says finish at 5, it actually means you have Monday off because they've given you 4 hours for private study. So technically, I'm only in clinic from 9 to 1, and then I get to go home or library or wherever I want to study and study for 4 hours and still get paid for that. Isn't that awesome? As you can see, these hours make GP a very, very attractive option. And the fact that, you know, you still get paid the same as your counterparts in the hospital makes that good too. You're very flexible, and I really feel like when you can plan your life, schedule your life, be able to make important life events and be happy as a doctor, you make a better doctor in general. So I just knew that the first week I started here, I just knew this was for me. And it wasn't just about, you know, the hours, but that's obviously a big consideration. It was also the continuity of care with patients. I get to see patients from the start to the finish. I get to know more about them, their personal lives, like being more involved in their care, and personally feel like I can make more of a difference that I would want to see from this point in primary care than I would be able to in the hospital, because I would see a patient in the hospital like one time and then literally I won't see them again. So it's nice to be able to see people come back and thank you and just develop proper relationships with people. I really enjoy that aspect of the job. I don't know if there's anyone that's considering GP, but you know, this is really what makes GP a great specialty to me, and I don't see why anyone would do anything else, but obviously I'm biased. Anyway, today I started at 9:30 and I'm going to be finishing at 6:30. So when I come in, I go through the list of patients I have to see. At the moment, I can see on my list that I've got a vaginal discharge coming. So in my mind, I'm thinking already of possible differentials. Could it be a UTI? Could it be an STI? Could it be thrush, or what it could be? So I'm going to be prepared to do a vaginal examination with a speculum. I'll make sure I have my swabs, which is at the back cupboard there, and make sure I send those to the lab, again depending on the symptoms, because if I'm sure like it's a UTI, I might not necessarily send those things. So it really depends on the history. I've also been seeing quite a few ear infections as well. So I've got a few on my list with 2 people, one that's younger and one that's older with an ear infection. So if it's like, middle ear infection, otitis media, then I'd be giving like antibiotics like penicillin, amoxicillin. We're wearing PPE to see every patient, so I'm just going to wear my PPE now. So I've got afternoon clinic now. As you saw earlier, I just made myself a cup of tea, which I'm loving. Anyway, I'm just looking through what patients I've got to see as well, kind of prepping ahead of time, thinking of differentials, thinking of treatments, and discussing any cases I might not be sure about with my supervisor. So the next case I've got is actually a telephone consultation. Well, not really a telephone consultation, but more of a follow-up of blood results. So this is not my patient. I mean, they're my patient now, but they're under another doctor. And basically they had blood tests to check their B12, folate and ferritin and their HB. And it's come back that, they've got iron deficiency anemia, so low iron levels. So I'm just going to give them a call on the phone and, discuss starting iron tablets. Because of their age as well, I can tell that she's still young and menstruating, so that could explain iron deficiency anemia. But I need to make sure that she's not bleeding from anywhere and find out whether her periods are heavy and all of that. Basically, we need to know why she's iron deficient. I mean, she's got heavy periods and stuff. That would explain that she's not bleeding anywhere, and that's fine. But yeah, I'm going to do a quick call. My name is Dr. Nosa. I'm one of the GP registrars calling. Is now a good time to talk? Great. Okay. Sorry, I was just calling to discuss your recent blood test results, if that's okay. Okay, so no worries. Right, are you happy to take, iron tablets? Because we can just have that sent to your pharmacy. And just bear in mind, they can cause black stools, and some people get some discomfort with it as well in their tummy. But if you find that happens, then you can reduce the frequency from 3 times a day to 2 times a day and see how that goes. Okay, as long as it's not causing you too much trouble, then I would encourage you to try and take it. Let's try and bring your iron levels back up, and you find that you'll be feeling better, hopefully, and less tired. Okay, perfect. Okay, thank you very much. Okay, so I'm just seeing a patient with back pain. Back pain is one of those ones where you just really don't know sometimes what to expect. So when I see back pain in the notes, because usually when a patient calls reception, the receptionist puts the presenting complaint in the notes just to let you know what exactly to expect. When I saw back pain, I was thinking, okay, this could be chronic back pain. I'll check the notes. Or could this be an upper UTI, so like pyelonephritis, which some people have? Could this be sciatica, which is basically an irritation of the nerve, in the back that goes down to the leg? So the major one that you always want to rule out with back pain, which is a medical emergency, spinal cord compression. And the main thing with spinal cord compression is that they would have neurological symptoms, so like weakness in the legs, sensation changes, loss of bladder control, either urine or stool or both. So when they came in, I obviously asked this question, and they said they had the weakness. I did a neurological examination, and there was definitely weakness there. I also did the PR, and there was definitely reduced anal tone, which is what you're checking for, the PR, basically when you're examining the back passage. So I referred them for an urgent MRI, and I'm sure it's likely going to show spinal cord compression, which will need spinal surgery intervention. So yeah, that's been a bit exciting, not for the patient, but just more from, you get to see some fairly acute stuff in GP, which you refer to the hospital. But yeah, I'm also seeing someone with, or actually 2 people with low mood, so depression and anxiety. They're actually known to have them, but they're struggling a bit lately, which is understandable because of the whole current climate and COVID and everything, and this just can be isolating and lonely. So yeah, just spoke to them, offered them counseling. One of them wanted to go on antidepressants, which I offered as well, so hopefully they find some benefit. And usually when you start people on antidepressants, you should be following them up in about 2 to 4 weeks just to find out whether it's working, if it's made any difference. If it's made a little bit of a difference but not quite where they want to be, you can increase the dose. So yeah, just to make sure that I tell the patient that they should book a follow-up, just to make sure that they're doing okay. And another thing I always need to remember, and every doctor should remember, if you're planning to be one, is that you should always ask about suicidal intent in anyone with low mood or just generally any mood disorder, because if there's any suicidal intent, then you need to get, crisis team and all of that involved. So I've just seen that I've got about 4 prescriptions to do. So basically, prescription just involves going through, like, looking at the patient request, the patients requesting their repeat medications, making sure that they still need the medications, making sure that they've had the appropriate follow-up blood test or the doctor reviews that they need. So for example, I've got someone here on a statin, so I just need to make sure that they've had LFT, their liver function, recently checked. Got someone else on blood pressure medication, Ramipro, which is an ACE inhibitor. In that case, you want to be checking using these at least once a year. So those are the kind of things I'm watching out for. So I've got a bit of time now, and when I've got some time, I just try and log on to my portfolio. So all GP trainees or all trainees in the UK always get a portfolio to keep up to date. And there's certain requirements we have to fulfill. So for example, you need to make sure that you're putting your learning case reviews, so what you've learned from different cases. You need to just provide evidence of different things. So anyway, I'll show you what the portfolio is. It's called 14 Fish. And if you didn't know this, because I was shocked, okay, when I first joined the GP register, the Royal College of GPs, which all new trainees have to join, you had to pay £276 to access this portfolio and other benefits of being a Royal College member. So yeah, I was a bit shocked by that amount actually. No one told me. And then when I joined, I also got access to this thing called, I think it's a totem card. You get like quite a few discounts, like off ASOS and a lot of other establishments really, but I just got it recently, which is nice. Regarding the £276 you have to pay for the Royal College of GPs, you can actually get about, I think, £40 back if you claim tax through the HRMC. So yeah, get your money right, okay? Anyway, I'm just going to quickly do an urgent 2-week wait referral for a possible melanoma. I don't know if you guys know what melanoma is, but it's basically a type of skin cancer, and I'll show you guys. As you can see, like, melanomas are basically they kind of present like moles sometimes, and this is when you should not worry, and this is when you should worry. And everyone can remembers the ABCDE mnemonic, so asymmetry, border, if it's regular or irregular. As you can see, the cancerous one is irregular. The color here is more uniform, I would say more like a reddish pink. This seems to have different colors in there. Diameter, as you can see here, moles that are non-cancerous tend to be smaller. This one's a bit wider. And one of the other signs is evolving to a mole that's non-cancerous would just be a simple mole, not getting worse. As you can see in this one, it's just getting bigger. So yeah, that's why I'm referring this lady for a 2-week wait referral, so she can have this mole biopsy to see if it's a cancer. It is likely though, to be fair. Anyway guys, that's the end of the vlog. Thank you guys so much for watching. I hope you found it somewhat interesting and you learned a few things or two about what a day is like in the day of a registrar or GP registrar. I'll see you guys in my next one.